Hello, everyone in Facebook and joining us in other places, Facebook, YouTube. My name is Terrell Parker, and I'm an associate manager at NMAC. Thank you for joining today's very quick, very special Facebook Live. We're here to share with you some really exciting information that we think is going to be game-changing for our work to end the HIV epidemic in the United States. So welcome to our quick and informal Escalate info session. Escalate is supported by the Health and Resources Services Administration of the U.S. Department of Health and Human Services, HHS, and the Minority HIV/AIDS Fund as a part of a financial assistance award totaling $1.6 million. So we just have to give our quick disclaimer and also give credit to our amazing funders who this work would not be possible without their support. So if you're joining us, maybe you have received our newsletters or you've heard a little bit about Escalate, but what is Escalate specifically? Escalate stands for Ending Stigma Through Collaboration and Lifting All to Empowerment. Amazing name, but beyond the name, Escalate focuses on training and building the capacity of participants to recognize, number one, and secondly, address HIV-related stigma within the Ryan White HIV/AIDS Resources Program. So, what is the purpose of Escalate, might you ask? The purpose of Escalate is twofold. One, we want to reduce stigma for people living with HIV on multiple levels throughout the healthcare delivery system, including on the individual client, organization, and systems level. And also, we want the Ryan White program to also focus on implementing various stigma reducing approaches with an emphasis on increasing cultural humility and care and treatment settings for people living with HIV within the Ryan White HIV/AIDS program. So, what does that mean exactly? When we talk about how do we eliminate and how do we reduce HIV-related stigma, we know that that is a monumental task. We are approaching over 40 years of HIV, and we still are dealing with a lot of the stigma that we dealt with early on during the pandemic. So, we have our partners here today that are going to share some really cool information about two aspects or two tracks of the Escalate project: technical assistance and learning collaboratives. The third part of the Escalate project is Escalate training. And as we said earlier, that focuses on training and empowering individuals who work within the Ryan White care system to be able to identify and address HIV-related stigma within the care systems. Because we realize that if we're going to end the HIV epidemic in the United States, we have to get honest and we have to get real. We are only going to do this if we significantly reduce HIV-related stigma. So without further ado, I don't want to take up too much of your time because tonight is not about me, it's about our partners highlighting the amazing work that they will do with our constituents. So up first, I would like to introduce Nikki, our partner at Abt Associates. Nikki, can you tell us a little bit about technical assistance and how organizations can specifically benefit from technical assistance? Thank you, Nikki.
Sure, Terrell. Yeah, thank you so much for that introduction. So, hi, everyone. My name is Nikki. I work at Abt Associates, and we are leading the technical assistance portion of Escalate. And technical assistance, or TA, is time limited tailored program to support organizations to address HIV stigma. It's really designed to create organizational level change through targeted work plans and increase the capacity and readiness of organizations to address HIV related stigma. And so, organizations that are best suited for TA are those organizations that have identified that specific need and are in that planning and building stages. And Abt here, we are really excited to be doing that work with you to help you along in these stages. So, TA really involves this one on one coaching relationship between an organization and a TA coach at Abt. And so, how organizations will benefit from TA is that they will have these monthly one on one check ins with a TA coach. They will get an individualized organizational assessment and a TA work plan really tailored towards the specific need that they have. And along with those that work plan, you will also get the expertise of a lot of subject matter experts that we have on our program, and it's going to be also a great opportunity to learn from other organizations that are at similar stages in this planning and building part of addressing HIV related stigma.
Thank you so much, Nikki, for sharing more about technical assistance. Folks may be asking, who will Escalate engage? Specifically, Escalate will gauge members of the Ryan White HIV/AIDS programs who are both recipients and subrecipients. This includes Ryan White Part A, B, C, and D. Unfortunately, Part F is not included in this round of Escalate. That doesn't mean it may not be available in the future, but for right now, unfortunately, it's only available for organizations that are recipients or subrecipients of Ryan White's Part A, B, C, and D. That includes community-based organizations, federally qualified health centers, health departments, planning councils, and planning bodies. So I want to stress the importance that everyone can be involved. Up next, I'd like to invite my partner, Chris LaRose from NORC NORC at the University of Chicago to tell us more about learning collaboratives and how organizations can benefit from participating in learning collaboratives.
Thanks, Terrell. Appreciate the time. So the learning collaboratives are basically longer opportunities for organizations to engage in peer-to-peer learning supported by subject matter experts within a framework that enables them to test out different stigma reduction activities, stigma reduction strategies, tools, and practices, and learn from those tests and apply it to what they do. Nikki, was kind enough to sort of frame, that for TA, it's mostly organizations that are at the planning and building stage, whereas for LCs, it's mostly for organizations who have a plan and are either right at that point where they're launching their initiative, or at the point where they've launched the initiative, they're implementing, their stigma reduction activities, but they might be having challenges and they want to find out how to get over those challenges. So with the LCs, we have a series of learning sessions spread out over probably about a 14-month period. There's opportunities for organizations to be paired in what we call affinity groups that will, each have an LC liaison, much like the TA coach. They would participate in those meetings, and then in between those meetings during what we're calling action periods, there's the opportunity for them to test out using what we call a PDSA cycle, Plan, Do, Study, Act cycle, supported by the LC team, to test out their strategies, their tools, their practices, and figure out what works, what needs to be adapted, what needs to be adopted, and what needs to be discarded. And so we're there to help folks through that process.
Thank you, Chris. Thank you for sharing. It's very important that we want our constituents to know that there are multiple ways that you can engage with the Escalate project. And we have been very intentional to make sure that we meet the needs of organizations and of the community. You can participate in training. Some of the benefits of our Escalate training is that participants will learn how to facilitate transformative and relational change within the Ryan White HIV/AIDS program. Participants will learn how to facilitate transformative and relational change in communities that they serve as well. So I just wanted to point that out because, as I said, there are 3 distinct tracks for Escalate that are really designed to meet your organization where you are and to ensure that you can place yourself somewhere and Escalate, because we really believe that if we're going to end the HIV epidemic in the United States, we have to get real about eliminating and reducing HIV-related stigma. So we hope that you're able to see yourself somewhere in our Escalate program model and figure out how you fit in. If you're interested in applying for Escalate, there is still an opportunity. Unfortunately, our training application for year 1 has closed, but it will reopen later this year, and you will have an opportunity to participate in future trainings. But if you think that you may be a good candidate for either technical assistance or learning collaboratives, guess what? There's still an opportunity to participate. Our application deadline is September 3rd, which means you have nearly 4 weeks to complete your TA or LC application. You don't want to miss this opportunity. If you're interested in applying, it's a really simple step. Go to targethiv.org/escalate, and you will see the link to our TA and LC application, as well as our frequently asked questions as well. We know, as I said earlier, that we are in the midst of our plan to end the HIV epidemic in the United States. And we know that ending the HIV epidemic in the United States means reducing HIV acquisitions by 90% by the year 2030. We are serious about reaching that benchmark. We are serious about reaching that goal. And we believe that reducing HIV-related stigma is at the center of reaching our goals to end the HIV epidemic in the United States. So I would like to open up the floor to any questions. And also, I would like to let everyone know that if you would like, there are other opportunities coming up to engage in webinars and other social media live discussions. As well, you can please feel free to reach out to us directly to schedule a one-on-one appointment with either our technical assistance team or our learning collaborative team to talk specifically about your needs and how you fit into the ESCALATE project model. So, without further ado, we'd like to open the floor for any questions that anyone has. What is something you wish applicants knew about ESCALATE? Great question. I'll start, and then Chris and Nikki, I'll give you an opportunity to answer that question as well. One thing that I want applicants to understand about ESCALATE is just the intentionality that went into the project, how large of a scope. We've been planning to implement this project for just about a year now. We've worked with just about over 60 subject matter experts, and that our implementation science team, that includes members of our community advisory team, that includes members of our constituent advisory panels, which represents the diverse racial and ethnic groups that are most impacted by HIV, that represents our diverse staff, that includes people living with HIV, people who are on PrEP, that includes our diverse partners with the wealth of knowledge and experience as well. So I want people to know that the people that are most impacted by HIV have been at the table in the design and implementation of ESCALATE from the very beginning. And we really feel as though this program is the first of its kind and truly unique at addressing HIV-related stigma at a systemic level. So from my perspective, that's one thing that I hope folks would know. Nikki and Chris, how about you?
Yeah, thanks, Terrell. I think to add on from my perspective, I would just say I really wish applicants, take away from this webinar that there is no one way to enter ESCALATE, and there's no wrong way to enter ESCALATE. So regardless of what path you apply for, our team is going to review your application in detail, and we're going to meet and see what makes most sense for your organization where you're at. And so, for instance, say you applied to training and the deadline for that was back in July, and say, we looked at your application and thought maybe, you're better suited for TA. That does not mean your application is going to be disqualified in any way. Like, they're just applying shows that interest, and that's what we're really looking for. So any way that you come to us is perfect.
And I would add to what Nikki and Terrell have said by saying that I feel like the passion and the commitment at multiple levels is here for folks. Nikki said this. There's different ways to get into the program. If you're looking at addressing this at an individual level, perhaps training is for you. If you're looking at like you have a passion to do something about this at an organizational level. The TA folks are there to help you sort of build up that stuff. And then, right at the end, the LC is there to sort of take, the work that you're already doing and help you to share your lessons and share your challenges and share your barriers, but also get solutions from other organizations like you. So I feel like Terrell has said this is a one of a kind, first of its kind sort of program. It's tapping it at multiple levels, and we have a lot of passion about doing the right thing in terms of stigma.
Yes, and I think someone asked, is there a cost associated with Escalate? It is not. There's not a cost associated with Escalate. It's free technical assistance. It's a free opportunity to participate in learning collaboratives, and it's a free opportunity for your organization to participate in training. So I know when we're talking about ending the HIV epidemic, we're really focused on increasing the capacity of our workforce. Well, this is a great opportunity to increase the capacity of your workforce without it having to impact your organization's budget. So another great reason why you should take advantage of Escalate. What are some of the common signs that an organization needs to apply for Escalate? Nikki, I'd love to yield to you as our TA expert. What's a sign that organizations may need to apply for Escalate?
I think anyone can benefit from Escalate, honestly. I think if you are working in the field of HIV care, I think Escalate is for you, honestly. And we have these 3 different paths, and they are designed to meet different needs that agencies and organizations might have. And as we said before, there's no wrong way to come to Escalate. I guess I can speak a little bit also on the TA perspective, Terrell. If, for instance, organizations are at that planning stage, they have identified a specific need that they have, something that they want to change in their organization to reduce HIV-related stigma, TA is for them. If they have that idea, but they're hitting a road bump, TA can help overcome that.
Absolutely. Thank you. I think that's a great idea. Chris, would you have anything that you'd like to add?
Of course. So organizations that have sort of started a stigma reduction initiative. It's worked in a couple of areas. It's worked with particular groups, but when they try to expand it to another group, it's not working, and they're trying to figure out why. That's the sort of sign that an organization may benefit from participating in a learning collaborative. If you're getting stuck, if you want to expand, if you want to do things. So, and I'm thinking of things like, stigma reduction initiatives could be things like looking at like the environment that your patients or your clients are in. Is that environment a welcoming environment? How do you identify what is welcoming to your clients? How do you get your clients engaged in sort of a back and forth conversation with you about their needs and about how they feel when they come into your organization? Those are the sorts of things that if you're having questions about that, you've already got something in place that would indicate that you can benefit from participation in a learning collaborative.
Awesome. Thank you. And we also had a question, is there a time commitment that folks can expect to contribute? For training specifically, there is a 30-hour time commitment that we anticipate folks will need to set aside. That is 30 hours within 1 week. So for training, it does happen within 1 block within a week. So 30 hours time commitment for training. Nikki and Chris.
Yeah, thanks, Terrell. So technical assistance, we are organizing that based on a cohort model. So that cohort is going to last for 9 months. And we are asking that every person from your organization who is participating in what we're calling a stigma reduction team, we ask that each team member commits 3 to 5 hours per month.
And for learning collaboratives, it's a little bit harder to quantify, because the assumption is that you're already putting in time and effort implementing a stigma reduction initiative. And so the learning collaborative is sort of on top of that. And what we're asking for folks to do is to participate in a 4.5-hour learning session. And there will be 4 of those over the 14-month period. In between that, there would be webinars. Those would only be sort of an hour each. And then there would be regular check-in calls with your LC liaison. There would also be the need to fill out a PDSA form to help you test and analyze the results from your test of the different activities that you're involved in. So while we can say it's about 30 hours, over the course of each of those learning action periods, that sort of how you spend that time on a monthly basis can differ.
Thank you, Chris. Do we have any other questions from the chat, maybe?
I see a question from Eric. If I could respond to that, Terrell?
Absolutely.
So, Eric, thank you so much. We are going to be looking at applications together and looking at what sort of track of the program an organization might be better suited for. However, we're not going to make that switch without talking to the folks who submitted the application. So what's likely to happen once we get the applications in, we'll review them together. We'll sort of sort who we think should go where, depending on also what those organizations have indicated. But where there's a little bit of play, where there might be an organization that is really so close to being in an LC, but they might need just a tiny little bit of TA, we're going to have those conversations with each other. We're going to make recommendations, and then we're going to come back to you and to your organization and say, you applied for this. This is what we think would suit you. This is why, and this is how we can help you. I hope that's helpful to you, Eric.
Chris, would there be an opportunity for some organizations to maybe participate in both? Maybe they send some folks on their staff to training, some folks may go through TA and learning collaboratives. Is that a possibility?
I could see in a best case scenario, folks at an organization going through training, standing up a program with the assistance of our colleagues in TA. And then once they've stood it up and they've launched it, the LC team stepping in to support them and basically help them improve their program.
Absolutely. Thank you, Chris. We have another question. What should I do if I want to apply, but my organization doesn't? I'll try to answer this question, and then I'd love to hear your feedback as well. I think if you're interested in applying, but your organization is not, I think that you may be a good candidate for training. For training, you need a stigma reduction team. That means you have to have at least 2 people. You have to have at least 1 person that's affiliated with the organization that's funded by Ryan White. And then you have to have at least 1 person living with HIV on your team as well. You do need an organizational letter of support. So your organization must say that they agree for you to go through training. But I think if you want to go through training, maybe it's a great opportunity for you to learn the information, take that information back to your organization, and perhaps prepare your organization to be ready for TA, learning collaboratives, or greater involvement in training in the future. Chris, Nikki, anything you'd like to add?
I could not have said it better, Terrell. I could not have said it better. That's
Same
the
here.
exact scenario. Yeah.
That was
Awesome.
perfect.
Maybe have more comments. Any more comments or questions before we wrap up for the evening?
Well, folks, unfortunately, it looks as if technology is getting the better of us. We've lost our colleague, Terrell Parker from NMAC. But in his absence, I want to say thank you. Oh, wait, here we go. Here's Terrell.
I had some technical difficulty, but thank you, Chris. We were just rolling right along with it. Thank you. I think Chris was just wrapping us up. Thank you all for joining us for today's quick Facebook Live informational. As we stated, if you're interested in applying for ESCALATE, please visit targethiv.org/escalate. or feel free to email us, escalate@nmac.org, and you can set up an opportunity to meet with one of our partners to discuss how you can engage with Escalate. All right. Thank you, everyone. Thank you to our partners for joining, and have a great night. We hope to receive your application soon.